All
right, well, thank you for the time on your agenda this afternoon to talk about the fiscal year 22 budget for Eastern Idaho Public Health. Some significant changes are included in this budget, and I'm sure you're very well aware of the legislation that's been passed having to do with the county energy funds, the CAP fund, and funding for public health. Just yesterday, Public Health's appropriation bill, they had to go back and redo it, reopen the budget, but it made it through the House and the Senate voted to approve it yesterday. So I've updated some of the language that was in the budget to reflect the current status. With the passing of House Bill 316, that does require, starting March 1st of 2022, that the counties assume the funding for the public health district at the level that the state had appropriated for fiscal year 21. And I have a page in here specifically that will talk about that separately.
Maybe the page will answer my question.
Okay. Our budget going into next year is higher than our last fiscal year budget, and it's simply because of the increased funding that we're receiving to continue the pandemic response, specifically with immunizations, and there's still extra funding for contact tracing and the epidemiological work that goes on with the disease. We've had some conversations with the state, just as an aside, that I think it's going to be expected for some time that we continue the disease investigation work that we're doing. Unfortunately, it's not being very productive, and the last report I received from James is that about 45% of the cases are non-responsive to our communication to them. So, but it's the expectation of the state because of the federal funding that we continue on with the contact tracing. And I don't know at what point it's deemed that the pandemic is over and all that will stop. So we're anxious to get to that point. So for the state appropriations, I think most of you know, I don't know, Commissioner Walker, if you're completely familiar, but there is a formula that the trustees of the public health districts have developed to divide out the state general fund appropriation. And as we put the total appropriation through that formula, our health district is going to get $809,500. That's 8 months worth of state funds to carry us through from July to February, and then the county funding will kick in at that point. On the county appropriation side, just for the normal appropriations is what I'm going to call them for our discussion, we're not asking for any increase from the county. We've been fortunate for the past several years not to have to request an increase, and that's carrying through this year. With our fees, we are anticipating a 17% increase, and we're having significant activity increases in the septic program, land development, food protection, and immunizations. Not just COVID immunizations, but just routine immunizations. And then in our subgrant funding, it is up 30%. And again, I had already mentioned that the majority of that is for the COVID response that we're continuing into this next fiscal year. Our subgrant shows up $30,000 this year for suicide prevention activities. That subgrant was initiated during this current fiscal year, but it was after our budget had already been set, and so it wasn't included in the original budget. And then we have a little bit of increased funding in our Women's Infant and Children, or WIC program, as well as the Tobacco Education and Prevention program. And then many subgrants from year to year fluctuate just up or down a little bit. We're not seeing significant changes in most of the others. And then just two items that decisions that we've made at the department is that we are not going to accept the oral health subgrant from the Department of Health and Welfare. And that work was to provide fluoride sealants, fluoride varnish to children, primarily uninsured children, But over time, the number of kids that are being served through that program is decreasing. We also lost our dental hygienist, and it's pretty difficult to recruit one at the salaries that we can offer through public health. After conversations with several dentists in our area, they feel like there's adequate dental practices to serve those children, all who should at this point pretty much have Medicaid and have access to a dental home. And James just told me also that for many years, we've helped facilitate the Give Kids a Smile Day, where dental offices from throughout the health district, the first Friday in February designated as a day that they provide free services for kids beyond just the cleanings, it's respiratory work. And over the last couple of years, participation in that event has decreased, which is an indication that kids are getting the dental services that they need. Another subgrant that we're not going to renew is the hospital preparedness program. And that is, it's kind of changed over time. It started back in 2002 when the preparedness program started overall. But this funded a part-time staff member who helped facilitate the coalition meetings. Your county emergency manager, fire chief, the fire department, EMS, the hospitals. It's expanded over time, that the participants in that coalition. But 2 years ago, the state changed the structure of that, and it's not just a coalition within our health district. It now includes health districts 5, 6, and 7. So from Burley clear up through our region. And they're really changing focus to hospitals. And in other areas of the state, the hospitals have been awarded that subgrant to help facilitate that work. Last year, our health district was awarded the facilitator and the pass-through role to help be the holder of the funding of whatever was going to happen within that coalition, and then pay out those costs. We're not going to fulfill that role anymore, but we will still be engaged in that coalition work with our region.
So who's picking that up?
I don't know yet. It could be one of the other health districts, 5 or 6, or it could be one of the hospitals. As the pandemic has gone on, the hospitals have really stepped in as the role of a facilitator, and for some time the Office of Emergency Management was holding weekly calls with all the hospitals in the state, and Public Health and Department of Health and Welfare and IOM, and the hospitals have really assumed the role of facilitating those regional coalitions. So I think it's just a natural flow that it could go to one of our hospitals, as it is over in the western part of the state. But potentially could go to another health district to facilitate that pass-through of funding. On the expense side of things, last year we were, and I report this to you for the last many years, that the salaries of the health district staff are at the lowest, at the bottom of all 7 health districts in the state. I didn't have it in time for a board meeting, but got it the next day, and we're tied for bottom again, but now with 2 other health districts. And we were not able to implement salary increases last year. And so we have budgeted for an average 6% salary increase, and that would be awarded based on performance and where an individual is within the pay scale. On the benefit side of things, we've been fortunate that our employer costs have not increased this year, but the cost to employees for their portion of the health insurance is increasing, and it varies depending on the type of plan they have and if they're full-time or part-time. So an average of 8.7% increase for full-time employees on their medical insurance costs.
Geri, have you heard what other health districts are doing across the state
For the health
for the
insurance,
cost of living?
it's all for the salary increases.
Yeah.
I have not heard specifically. I mean, everyone, I think, is right at that point of submitting their plans, but I have not heard.
Nobody's, you usually don't talk amongst
We
yourselves
do.
about that.
We just not have the opportunity. So we
Okay.
actually have a call at 4 o'clock this afternoon, and that's something we can talk
Who are
about.
we tied with for the low?
I would have to go back and look. I think Health District 5, potentially
down on this side of the state.
in Twin Falls,
'Cause if
but
you-
not 6. They were higher.
okay.
And we have lost staff to Health District 6 to do the same work for a much higher pay.
Because there is a cost of living difference in different areas, and that's why I'm
certainly.
curious. Because if you're low compared to Ada County,
Everyone's low compared to Ada County.
Hmm.
Just on the overall operating expenses, the budget is increased just a little over 7%, and I'm sure you all know that cost of all supplies have increased, and also that accounts for the increase in vaccination supplies that are needed with the COVID vaccination effort. So
Are you seeing is it netting out the administration fee that you're able to get through insurance? Is that,
it is
Like
right now
it's paying
covering the
for it?
costs
Okay.
for us.
okay,
Some other health districts are not billing insurance. We've also been participating in the capacity building grant funds that the state was awarding to any provider, that you get a certain incentive for the first shot and the second shot. It's 25 for the first shot, 15 for the second shot. So $40 if you do both first and second doses. And with that, it is covering our costs. There's no need for any additional support for that.
do you know what percent are not insured, that you're not getting anything from?
I don't. I could ask Amy to find that out. And there is a resource that you can bill the federal government to cover the cost of
Oh,
those,
really?
but we have not been pursuing that.
because your number of uninsured should be decreasing with
Lower.
Medicaid.
And the capacity building grant that I was mentioning, that ends the end of the fiscal year. So going into next year, our revenue will decrease from that, but we just received a sub-grant from the Department of Health and Welfare for $447,000 to continue it's a 3-year sub-grant, and we're asking some questions about what that looks like for 3 years. But that would help fund those activities well, really focusing on trying to get out into the more rural areas, do mobile clinics, get to the people where they are that may have a barrier that's preventing them from accessing the vaccine. All right, if you look at page 3, just a summary by division of revenue as well as expenses. The change in salaries for the year is almost 22% over last year. I would tell you that's not all tied to the salary increase. We have had a significant number of temporary employees added this year because of our response. The contact tracers that we've hired, those positions have been going away as things have slowed down. But right now we have over 20 temporary employees in the immunization department across the health district helping with the COVID vaccination effort. Benefit costs you can see are up, and some of that is, well, all of it is related to benefits are based on a percentage of an employee's hourly wage, and so that is increasing as well. On page 4 has the summary of all of our funding sources, and I've highlighted for fiscal year 22. Sub-grants you can see is up significantly. Fees are up a little bit. The normal county contributions is remaining the same. You see the decrease in the state appropriation from what we talked about. That just represents 8 months worth of funding. Interest is what it is. We are requesting that $400,000 of the revenue that we are anticipating to occur in this fiscal year be carried over into next year to continue some of the back end work on the vaccinations. You know, it's one thing to schedule the appointment and administer the shot, but then on the back end, it has to be entered into IRIS and into our medical record. And so it does take some clerical work on the back end, and that will continue as we have administered 50,000 doses of vaccine. That's where a lot of those temporary employees have have been put to work. I just want to point out that our total revenue is over 9.8 million. And right below that, you can see potential carryover of 312,000. That is funding that is above what we anticipate our expenses to be. And as we had discussion with the board, the decision was just to keep that as carryover. I think we have a lot of unknowns going into this next year with the impact of 316, and just have that in a savings account to draw on as needed. Okay, looking at page 5, this is where we break out the appropriation to the counties, and this is for the normal appropriation for the benefit of Commissioner Walker. In Idaho Code 39425, there's a formula that describes how the funding is broken down to the counties. And so based on the amount that we request from the county, so in this case, the $1.1 million, it's put through that formula of 70% population, 30% taxable market value, and then it's shown there of what that works out to be for each individual county. And so included here is the population estimate for 2020. I will tell you that the census did not publish estimate numbers or any numbers this year. And so we were provided with estimates from the Department of Commerce. And then each year, the tax commission does provide us with the taxable market value for the county. And so you can see on the bottom part of that chart, even though we're not asking for any overall increase in the total county appropriation, it does vary from county to county from last year based on changes in your population or your property values. And so for Bonneville County, obviously, a little bit of increase, 1.02% increase, amounting to 5761. And so the total appropriation that we're requesting for next year for this part is $571,176. The next page is where we lay out the detail on House Bill 316. And we use that same formula that is, it was included in the bill that it should be appropriated according to 39.424 unless an alternative manner of apportioning the additional aid is agreed to by the budget committees of the various health districts. At this point in time, for the development of this budget, we just put it through that normal formula. And quite honestly, we still have time to come back and revisit this because we have until March to determine what that really looks like.
I don't know how we would change it.
I don't either, especially where all of our counties are in the red. There are some, and when I say that, meaning that what it's going to cost you to fund the extra for the health district is more than you're going to save in your indigent fund.
That was a question I had earlier. Does this 193,000 just cover that March through October period?
It only covers March through June, our fiscal year.
March through June, but then
when you budget, you would need
we
to
have to
include
cover
through the
June
remainder of your
through-
fiscal year.
Yeah,
so it's going to
to
be
the end of the
It's
year.
going to be higher than that
Yeah,
because that will be the full board.
that's true.
So we're going to have to calculate what that number is as we look at it.
Would it be prorated on a monthly basis? So this is 4 months.
This is 4 months worth.
And so if we took it on a monthly and just calculated it out, it should.
So you're divided by 4, about $50,000 a month.
Yeah.
And it takes it through
June.
June 1st or June
June
30th.
30th.
Would be
So
another
July,
150,000.
August, September, October.
No,
Another
not
200,000.
October. We
Starts
just got to make it
October
first,
1st, right?
October.
Yeah,
So
150.
another 150,000
So for our
for
consideration of our budget,
budgeting, yeah.
we'll need to put in 350.
Yeah.
We'll take that out of the chairman of the health district salary.
Another change that was made as part of House Bill 316 is that the health districts already have a budget committee, and it's in statute that it's made up of the chairman of each of the county commissions. Previously, the chairman could give a proxy to anyone to represent them at that budget hearing. But in this new 316 bill, it does require the proxy, if assigned, the proxy has to be to another commissioner of that county. So that won't go into effect for this budget hearing that we're going to have in June, but it will be in place for next year's budget hearing. And speaking of the budget hearing, it's going to be on June 3rd at 9 a.m. We'll have it here at our health district office. As the chairman, certainly I extend that invitation to you to join us for
As the
that.
chairman, I usually delegate that gladly.
And then on page 7, again, it just has the data to support the numbers that we've been talking about, the county population. And Brian, hopefully how I relabeled that makes a little more sense to you and is not as confusing, that it shows
It
for the
does.
county, it's for those years, but it relates to our fiscal year budget.
Yeah, it does. It's much clearer.
So that is my presentation. Just for Commissioner Walker, on June 3rd, when we have our public hearing for the budget, the commissioners or the budget committee just votes on the county appropriation piece. And I guess we've not really talked about this, but are we going to propose that we vote on both the normal and this amount? And that could be discussion.
I would think we would.
Okay, that's what I'll plan
Yeah,
for. With 316, it written into the bill, it does allow us to continue the relationships that we have in place with like the state controller's office. We still participate in Percy. We still participate in the state's health insurance, medical insurance, the risk management. And at this point, we're still required to follow the Division of Human Resources rules. A change that was included in 316 was it does list out specifically that the respective Board of Health is solely responsible for setting the salaries of the health district employees. And it doesn't go to the authority of anyone in DHR or the Legislative Services Office.
which is a good move.
Which means they can't block the raise and the overtime.
And when will that go into effect then?
Well, not until March 1st.
It is March. It's not January.
No.
Okay.
And that was the other thing, that when we were at our board meeting, in the bill itself, it says that the counties, and I brought copies of it if you guys have not seen it. When it talks about the additional aid to the districts, it says, beginning on January 1st, 2022, and each year thereafter, the commissioner shall be responsible for providing the additional aid. Yet the bill in its entirety doesn't go into effect until March 1st. I did reach out to Legislative Services analyst, and he clarified that no, it would be March that you'd be fiscally responsible, and that was followed up with 8 months of funding from the state. So that was not very clear in the bill. So.
It certainly could have a little more lively discussion on the salaries of the health district, where the entire amount's going to come out of the pockets of the counties. And so amongst the 8 commissioners on there, it might not be quite as unanimous as it's been in the
No,
past.
I understand. And
Especially when you're proposing 6% with 0 last year. That's an average of 3, and many counties weren't able to probably meet that for their own employees. So I think that'll be a consideration that you'll probably hear.
The problem is you've got to take into account that our health district is so far below
Well, I know
what the
Or catch up time.
average is. Yeah, we're trying to catch up.
but we're trying to do that all across the board.
Yeah,
So, and then, you know, with the personalities of the different counties, if you're asking 6, and with the benefit load, that's about probably 7.5% in new money. Whereas a county, you know, is looking for a 2%, which is a little less than 3%.
Well, and I would just say that, you know, we have always kept what we've asked the counties for an increase to be as minimal as possible. And, you know, certainly we're not going to budget something that we don't think that we can afford, and are very cognizant of the extra burden that's going to be on the county. So,
Well, I'm not saying that's, you know, that's to say, I'm just,
Yeah.
that's a reality now that you're
well,
dealing
and
strictly with the counties. Because there's been times the state wouldn't give any money for cost of living, and then they said, well, go ask the counties to make it up. I don't know if you were around in those
that
years.
was before my time.
Yeah, so,
No, I think it's going to be a lot more in-depth discussions amongst our board going forward as far as, you know, the programs that we offer and where what we've called district dollars in the past, the state and the county combined funds of what they go to support, and looking at some of that in a little more detail and evaluating everything.
well, and that makes the discussion easier if you're evaluating expenses along with the, and finding offsets for it. So,
No, there are certainly a lot of unknowns, and it makes me a little anxious as we move forward, and I'm sure you as well. I mean, because you're going to have continued costs in the indigent fund, I anticipate, and granted, hopefully much lower, but I don't know that we really know what it's going to look like as we sit here today.
yeah. I mean, I've certainly had a front seat to it, but you followed it as close as I have nearly, and there is no other county function. There's no other department in the state that's worked harder than health districts this year. And so to think that, you know, that they can continue to do this, you know, on no overtime, on no, you know, increase in salary, is just, I think that's going to be a hard argument to make.
Another thing that, you know, in the bill, right now, we have been delegated authority and responsibility for a lot of programs through Department of Health and Welfare and from DEQ. And so in the new bill that was passed, it talks about how we can enter into contractual agreements with those agencies now, and not necessarily be delegated to do the work that we've always done. I think as we go forward and as we get sub-grants that come to us from Health and Welfare, you know, we evaluate it, and can we do what they're asking us to do for what funding they're providing? And that's going to be hard discussions with Health and Welfare going forward, because a lot of times now it doesn't fully cover the cost of, you know, the work they're asking us to do. So,
which I think is a positive change,
Yeah,
because, you know, just like we're dealing with other contracts,
yeah,
like with that one,
Right.
you've got to get it to where it pays.
yeah, that's right.
so it's going to be a year of learning and trying to figure out what this looks like going forward. But we're committed to doing the best we can for the most cost-efficient way possible. Aside from the budget, I just want both of you to know what an asset Commissioner Reed has been to public health, not just our health district, but across the state. He has been a leader of the state in the response on behalf of public health, and I want to make sure you guys know that.
Nobody knows or appreciates it more than I do.
So,
Well, except for probably me, who would have been thrown in.
Yeah.
I'm so glad.
See, this was one of those, I
Brian,
mean,
said, no,
who I worked with before, the level of dedication. And it's just, okay, you know, this is a simple board. It was my sales pitch to him.
you really say that?
It's
and
worthwhile.
it usually was,
Doesn't
right?
take much time.
I think you should talk to your religious leader.
I wondered why you allowed me to do it instead of you taking it, because it was so much fun
I know.
until this year.
Well, he told me that. He said, I'm really enjoying this. And then, bam.
Yeah, we all got thrust into the limelight that we never asked for, but,
Yeah,
Well,
it's been a extremely difficult year for Jerry more than anybody.
No,
But-
we get that.
But I'm proud of the decisions that we made
Me too.
and everything that we did.
me too.
I think we did the right thing. We got a lot of criticism at times,
Really?
but we did
yes,
the
we got
right
it.
thing. Well,
Yeah,
including
we
you,
look forward to
Roger, when
watching
you
all your
brought in the
videos.
mission accomplished.
It's really easy to defend.
That wasn't a criticism. That was
I
a reality
I
check.
got it.
I'm kidding.
Yeah.
And every one of them that was truly interested, I just said, well, why don't you go to YouTube and watch the meeting, and then we'll talk about it. And they call me back after and say, oh, because you guys have done such a great job. And I appreciate that.
Thank you.
And there must have been something that went from watching those meetings and getting the information that got lost in the airwaves when it was repeated by your local talk show.
Yeah, and sometimes the newspaper.
Yeah.
So, yeah, but we're at a really good place
Yes,
now.
we are.
Thank
Yes, we
goodness
pay
for
what you're worth.
vaccine.
That's all.
So,
Just a question, when you're talking about having a hard time following up only about half reporting, is that reporting contacts or reporting cases?
It's the individuals that are infected and us reaching out to them to, give them instruction or
Okay.
do the contact tracing with them.
So the reporting is still coming from hospitals and those who actually go get checked and tested?
Yes. Is it 100%? Probably not. And one of the challenges is more rapid testing became available. A lot of other people could do that than providers that were used to reporting communicable diseases. And so I
Records on
suspect
rapid
that,
testing and all.
there's a lot of positive tests that went unreported. And now people sounds like can go to Sam's Club or wherever and get your own rapid test, and with the instructions, you're supposed to report this to your provider so it can be reported. I think we all know
Likely
that
gonna do
that will not
right.
happen, but so we've known all along that probably the real level of illness that was circulating is not what was represented in the numbers. It was just that which we knew of.
It was
So-
higher. It was higher.
Mhm.
Probably is higher now, but not, higher of a 6 is a lot different than higher of a 30.
Yeah, the numbers are looking really good.
Just one last thing, as we talk about, we've been working with, all the providers that wanted to be COVID vaccine providers. The fire department has been very helpful in servicing homebound individuals. But there's a lot of, as I mentioned earlier, interest in providers going out more into the communities and providing services, mobile clinics, pop-up clinics, at events to try to get easier access to the vaccine for individuals in a hope that more people will receive the vaccine. As a state, there was a goal set in our health district. We have a ways to go to meet that goal. The level of interest in the demand for the vaccine right now is very, very low. So
It's fair to say that anybody who wants it can call up and get it that quick.
absolutely. And we are anticipating that probably Wednesday, it will be authorized for use in 12 to 15-year-olds. So I think we'll see a little bump for a couple of weeks as a result of that action. But we're far from having herd immunity. So just the more that we can encourage people, educate people, we're really just trying to focus on the ones that are maybe on the fence, that middle ground. We know that there's probably 30% of the population that will never get the vaccine, and we're not trying to spend our efforts there. But to those that have an interest and just for whatever reason have delayed in getting it. So if you're aware of any areas throughout the county that you feel like might be underserved, if you would just let us know, we will either us or work with other providers to make sure that we reach out and make sure the vaccine is accessible.
Geri, do you anticipate more vaccine being given by providers to take some of the burden off of you? I mean, in the past, most vaccinations have been through private doctors, right?
Yeah, and many providers are doing it and have been since the start. Mountain View has been a major player in Bonneville County, but also the retail pharmacies have played a huge role in this vaccine rollout with Walgreens, Walmart, Albertsons, Fred Meyer, even Brolam's pharmacies. We've had so many providers step up to assist. I would say the amount of vaccines that have been given through our health department, I think is kind of commensurate with the level of vaccinations we do year round. Many other health districts don't do a lot of vaccinations, but that has been one service that our health district has led the state in providing that service. But no, there's challenges for individual providers, and I think up until this point, even more so because of the storage and the storage requirements and the shelf life of the vaccine, that makes it very, very difficult to use it all up.
Yeah.
Last week, the state did share with providers guidance that at this point we have adequate supply of vaccine, and providers should focus now on actually, if we have to open a vial to administer one vaccine to one person, we want to get that one person vaccinated and to not be so concerned about doses that might go to waste. So,
Did you reach out? Did you ever get a hold of Heather at the crisis center about supplying them some Johnson & Johnson?
I talked to their pharmacy. I think I mentioned to you that the Genoa Healthcare that works under RHS is a COVID vaccine
Right.
provider. I talked to the person there and he was going to reach out to her.
Okay.
So,
Well, thank you.
all right, thank you. Appreciate your time, and
That was an
Will be-
all-encompassing thank you.
It's nice to see you in person.
yeah, you too. Haven't met face to face since you've taken on this role, but
Or face mask.
okay.
I have all the dad jokes.
Yeah, he's always this way.
That's a penalty.